So our next speaker is Mike Engler, and he is a resident of Amarillo and the CEO, president, and chairman of the board of Cactus Feeders. And Cactus Feeders operate 7 feed yards in the Texas Panhandle and 2 in southwest Kansas. And prior to joining Cactus Feeders, he was an assistant professor at the University of Texas Medical School in Houston, and later became a senior project manager for biologics for Langford and literally Prax Biologicals, both that were subsidiaries of American Cyanamid. And while at the University of Texas and continuing at Cyanamid, he worked on various vaccine research projects, including bacterial pneumonia in cattle. Currently, he's serving on the Texas Tech International Center for Food Industry Excellence's Advisory Board, the Advisory Board of the USDA CAP grant on BRD, the Texas A&M Animal Science Advisory Board. He received his bachelor's and doctorate degrees from Johns Hopkins and completed his postdoc graduation from Harvard Medical School Department of Biological Chemistry. Mike.
Thank you. I guess this is working. Everyone hear me? It's great. It's great to be here today. What a great start. I wish I had as much data as you did. Feed yards suffer from data, and we'll get to that in a moment. First, I want to thank my co-authors. Carter King is in the audience today, but also Paul D4 and Justin Gleghorn. Without them, I wouldn't have any slides, so it would be a pretty boring talk. So I really appreciate that. As mentioned, we do have 7 feed yards in Texas and 2 in Kansas. We also have a Cowcalf, a dry lot facility at Syracuse, Kansas. And our head capacity, one-time capacity, over 500,000 animals, allows us to ship about 1 million animals per year. That translates into about 20,000 animals a week, 14 million pounds of red meat per week. We manufacture nearly 3 million tons of feed a year to feed those animals with these wet rations that we're feeding today, and buy about 50 million bushels of corn. Let's get started. What I wanted to talk about today were 3 topics. First, to survey our mortality trends over time. Talk a little bit about the nature of, that would be total mortality. Talk about the nature of BRD mortality at Cactus. And then final topic, I'd like to talk a little bit about, a little more controversial topic, gets a little conversation going these days about late day mortality in the feed yards. So here's our experience over the last 13 years, going back to 2001. What this is all our steers, native steers, we've excluded the Mexicans and the Holsteins. We've got this broken out by this is closed out year, so month of closeout. I hate to get too technical because I have to make a switch later on to placement month, but generally speaking, we have yearly buckets, and we split it out by weight classes. So you can see that our 6-weight in weights, or steers, I was trying to get to the pointer. Not as good as this as I used to be. Okay, so the 6-weight steers up here are obviously experiencing more death loss than our 8-weight steers coming in, with the 7-weight being somewhat intermediate. Generally speaking, we would not class an 8-weight steer as high risk, just because it's had an opportunity to spend more time in a growth phase somewhere outside a feed yard. Generally speaking, that would not be a high-risk animal, and most of our high-risk animals are probably on the blue line here. When we tried to fit that with some curves or some lines, you can see that we did come up with some different slopes for the different classes of cattle, classes of weight, but they're somewhat similar. We've got a slope of 0.04 for the 8 weights, 0.06, that's an increased percentage per year, and 0.1 for the 6 weights. You can also see, it's fairly obvious, that 2012 was a pretty bad year. And we've confirmed that with other sources such as Elanco's benchmark database. I'm sure a lot of you folks experienced the same going on in your feed yards. We were in the middle of extreme drought. We had a lot of drought-out cattle coming to the feed yards. Feed yards were hot and dusty. There's a lot of animals on this slide, nearly 7 million animals on this slide. And it is a selected population, of course, not everything we had. But 2012 did kind of stick out for us, so what we decided to do is see what it looked like if we took it out. And you can see that the trend line looks a little better when you take it out, and now the lines look a little more parallel. The slopes are from 0.04 to 0.05. The p-values for the slope being greater than 0 are quite significant, and it looks like 2013 is right back on the trend line. I think that's the other important thing. We got 2012 behind us. So I think all that's very good data to kind of say, set the stage on where we've been over the last 13 years. But this is total mortality among just this set of cattle. So the next slide, we're going to confuse you a little bit. Okay, first summarizing that, we've seen this increasing mortality over that whole time frame. That would be very consistent with the NARMS data. I think we're probably right in the middle of that data set. 12 was a very bad year for us, and over a 10-year period, we'd expect that our mortality is going up 0.5% every 10 years. That is unacceptable. Obviously, at these sort of prices, we have never experienced death loss that's costing us this much money. In fact, I asked that. In 2013 through May of this year, our break-even system says that an increase of 1% in death loss is worth $20 a head on all the animals we market. So $20 a head on the whole pen for 1% increase in death loss. It's incredible. 2/3 of that is due to the cost of the animal, and since 2001 to 2013, that cost doubled. And it's even higher today, of course, as we pay more money every day for feeder cattle that are hard to find. So let me go forward to BRD. And I'm going to split this out for the period before 2012 and since 2012. In the 10 years before 2012, we had, and this would probably fit pretty close to some of the things that Mark was talking about, we had BRD mortality about 2/3, high 60s of the total mortality in the feed yard. Now, this is feed yard diagnosis, obviously. Consulting veterinarians, Carter and Sam Ives can post a few, but it's mostly doctoring crews in the feed yards. We also had pull rates or morbidity rates about 6 to 8%. Maybe that's a little lower than some of the data, and we felt pretty good about that. And case fatality rates below 10% in the 8 to 10% range. We were getting along great. 2010, 12, and 13, we changed our buy significantly. And we tried to not buy high-risk cattle. It didn't affect the market much, but we tried to go to totally low-risk cattle. And we did it successfully for quite some period of time. I mostly look at the data as we ship out every week, and every Monday morning we have an analysis of how we did in the packing plant the week before. And one of the numbers I always look at is percent low-risk cattle in that population that we shipped the prior week. And we had achieved months and months and months of zero low-risk cattle or high-risk cattle in our populations. So we went out and changed our buy. We increased our in weights over that period of time. And here's what we experienced, 2012 and 13, and I guess it's probably extending through 14, is that our BRD mortality did go down as a percentage of the total. Our pull rates, let me show you that, 3.9% went down, but our case fatality rates went up. We had more difficulty treating the animals that we pulled. Also, the pulls were later in the feeding period. So a lot of things were going on and certainly somewhat confusing. If you look back at that, if you think back to the slide where 2012 was so bad for us, that was in all weight classes of our native steers, but especially in the 6 weights, we were still experiencing very typical BRD outbreaks in those 6-weight calves. That big peak that went up that was on the previous slide. Most of our death loss was in the first half of the feeding period. The highest was in the first quarter of the feeding period. So that was very, very typical for us. But that was just on that one subset of cattle, the 6-weight steers coming in. Our overall death loss for BRD was actually going down. So it's somewhat confusing, and I will admit that if you look at different data sets from production data out of feed yards, and I think all of you in the room do that, it's really difficult to make solid conclusions because it seems almost that what I'm telling you is conflicting here experiences. But it's very important to isolate subpopulations if you can make any conclusions at all. So, let's see what's next. So here's our thoughts on BRD mortality as we were going through that period. The overall trend has been an increasing in weights, yet the cattle are younger, no doubt. We experienced, as we made that transition in 2012, an increased lung lesions at our arrivals. This would be prior damage. As these animals have been out in backgrounding situations, growth situations, they are experiencing BRD, and sometimes that shows up in the feed yard, and sometimes it just doesn't show up at the beginning of the feeding period. We have a perception of decreased response to BRD therapy. I don't know what that means, but that's what we're experiencing. And finally, we were in the midst of a horrible drought. So we know a lot of animals came to the feed yard damaged immunologically. We know that when they were in the feed yard, they were in a horrible environment, whether that's the dust or the intense heat and the lack of nighttime cooling. This last point has led a lot of people to talk about late-day mortality, which is my next topic. And it's led to a lot of conjecture that says that, maybe these animals are being stressed, they're pushed too far. Maybe our terminal feeding strategy is contributing a lot to a movement of upfront death loss to back-end death loss. And I can tell you it's really expensive to see them die just before they're going to the packing plant. So here's what we kind of think about late-day mortality. This conversation that's going on in the industry, it suffers from a number of deficiencies. The first is a lack of definition. Some people will talk about late-day mortality as if it is only during the terminal feeding phase on the beta agonist. So only the last 20 to 28 days, depending on whether you're a Optiflex or used to be a Zilpadrol feeder, a very defined late-day period. We analyzed our own data in quartiles of the feeding period, that is different quarters, and a 200-day feeding period has a 50-day last quarter. A 160-day feeding period has a 40-day last quarter. So there's a deficiency in how we defined and looked at our data, and so I think it lacks a definition, and we need to have one so that we all know what we're talking about. The obvious thing here is the lack of control, and we see that in a lot of feed yard analysis, that, and including mine, that the power of the control is an unbelievable scientific tool, and we don't have it in these situations, and it really makes it difficult on how you can make any sort of conclusion. There's extremely complex interactions. Just think about the drought, the environment that we went through, and our population of inference is changing constantly. So we went back with our analysis. I'm not going to show it today because it's really confusing. And we looked at the 4 quartiles of the feeding period for the different classes of cattle I talked to you about, the 6, 7, and 8 weight cattle. And we looked at when the cattle died. First quarter, second quarter, third quarter, fourth quarter. Every year is different. There are some consistent patterns. The 6 weight cattle like to die up front. The 8 weight cattle get along a little better at the beginning and die sometimes at the end. And in fact, one of the conclusions in our operation is if you get along too well at the beginning, you're just going to have some problems at the end. So, it's really, really difficult to look at all of this. And I think the conclusions that you may see are suspect because of that. So what questions do we need to ask to move forward on this proposition? And by the way, we do believe that BRD that we either buy or occurs early in the feeding period is affecting our late mortalities also. But what does late day mean? What factors and characteristics matter? And how does one determine which factors matter? So we have an idea to go forward, and that is to work on a predictive model. We think that if you're going to try to escape the necessity of having a control, you have to minimize your type 1 and type 2 errors. I'm not a statistician. When I went to graduate school, they didn't teach statistics to biochemists. They said if you can't tell the difference between the 2 lines on an enzymological titration, then you got to do the experiment over because there's probably no difference. So it was eyeball statistics. But I'm told that type 1 has to do when you think that there is a difference and there's not. And type 2 is you think there's no difference and there is. Both are disasters to the industry if we make a wrong conclusion. There's no doubt about that. And also is from a responsible societal position, we also are making bad decisions. So a predictive model is what we want to do going forward, and we have already lined up some collaborators in this effort. We've got microbeef technology accumulating data for us. We have Beef Marketing Group cooperating with us, and we've got Texas A&M. We're going to go back to 2007 with a data set because we want to go back to the beginning of the Zilpaterol. We'd be encouraged to have anybody else that wants to collaborate or cooperate with that study to make sure that it's got a great data set going forward. We think that predictive model will bring economic utility. We're all running businesses, so it'd be nice to have it be more than just an academic exercise. And what I mean there is that possibly it could give us clues onto changing management strategies or interventions almost real time as things are going on. And we think it's the responsible course for minimizing the risk of a misattribution of what's causing this late-day mortality. Predictive models provide discipline to scientists. There is a scientific method, and if you're going to try to get away without a control, we need to have some discipline to provide that regardless of, because the data sets are not going to have controls. A factor is either useful or explaining variation, or it isn't. And you might find one later that replaces a factor, but for today it's useful. We're going to get this started in earnest next month with the arrival of a graduate student from A&M at our place in Amarillo. Just one factor that's got to be considered to show you just how complicated this can get. Hot carcass weight. We have, when we analyzed our low-risk non-Mexican steers over the 13 years, and we looked at the different weight classes, and we tried to hold the days on feed constant. So we looked at the meat of each class and tried to find a small subset so that the days on feed wouldn't confound it. We saw that there was an increase in hot carcass weight over that whole period that averaged 4.9 pounds per year. We are making the cattle bigger. That doesn't surprise anyone. But what is kind of interesting is that that's kind of the baseline increase. And when we went, that started before we had beta agonists. As we went to Optiflex and we saw a jump up, because the technology does work, but we also saw the 4.9% slope continue through the Optiflex years. When we switched to Zilpaterol, it jumped up again, but we saw the baseline 4.9% increase per year continuing even over the Zilpaterol years. We don't have enough data yet for this year because we lost Zilpaterol just about this time last year. So that's our situation on late-day mortality. So here's my conclusion slide, and would welcome any questions as we go forward. We have experienced about an increasing rate of mortality of about 0.05% per year over a 13-year data set. Recently, BRD mortality has decreased with our increase in our in-weights and featuring low-risk cattle, but we've had a higher case fatality rate even as that's been going on. And we think the study of late-day mortality should start with the definition and emphasize the utility and discipline of a predictive model. Thank you very much.